All this is Dr. Mobeen Sayed from drbeen.com. Welcome to one more show. So, very quick show of the disclaimer. So, please make sure that you read this afterwards or now, or pause the video and read it. Now, let's start our discussion. Someone had asked, a cool bean had asked that what are the latest updates for vaccine efficacy? And of course, Luffy is agreeing with this as well. So what I thought, I'll do a series of various vaccines and their efficacy. So today we're going to start with Pfizer, then we'll continue on to Moderna and other. So let's start our discussion. What I'm going to do is the following. The very first thing. So here you can see that there are tons of references. I have tried to pull as many references as possible for this discussion. All of them are present in the description as well, the links to them. So these are some important references. I want to look at this one before any of the discussion, but just let's very quickly see the references. This is a effectiveness of 1 dose of BioNTech. This is nationwide mass vaccination and the effect of that. This is Yale Medicine, a beautifully written article. I have taken a lot of clues from here as well. So credit to them. And I would recommend you that you look at this as well. This is FDA's CDC vaccines approvals. Then here is the requirement of the 2 shots and the storage. This is FDA's storage. Storage guidelines for Pfizer. This is the warnings about Pfizer by FDA, especially for the cardiac inflammation for youngsters. This is the data. Now, please check the link here. It is assets.publishing.service.gov.uk. So this is a UK government document. What they have done is that they have used their yellow card system and pulled the data from there and put it together in here. And this is about Pfizer-BioNTech side effects. And if I can very quickly go to the bottom of it, this is a list of all the side effects. And at the bottom, if you see, this is the total reactions for drug, 324,654, total reports, 114,752, total fatal outcomes, 534. So I wanted us to kind of look at this. And those folks who would say that this is Mubin just telling something negative about the vaccine, this is UK government's data. And they say a report of suspected adverse reaction to the yellow card scheme does not necessarily mean that it was caused by the vaccine, only that the reporter has a suspicion it may have. Underlying or previously undiagnosed illness unrelated to vaccination can also be a factor in such reports. So this is right over here. We see it at the same time. This is UK government's report of the yellow card system. So we'll look into that a little bit as well, but I've already given you the punchline for what is in there. This is Pfizer's various news about the efficacy. What I'm showing you here is the writings or articles from where I pulled the data. I spent majority of the day today to work on this data to pull it. I may still not have gotten all the data, but I think you would be comfortable with what we have so far. And then there are some studies here as well, for example, this one. So with this, I want to go to this study first of all. This is on CDC's site, effectiveness of BioNTech vaccine in adolescent during outbreak of SARS-CoV-2 Delta variant infection, Israel 2021. Why I want to look at this one first before we do anything else is that we usually have not seen a lot of data about adolescent. And it is something that we get concerned about. I get very concerned about these vaccines and the children. So here, I want to quickly look at this. That is right off the bat. This is a new thing for us. So study. We performed a nationwide retrospective cohort study to estimate vaccine effectiveness against PCR confirmed SARS-CoV-2 infection among adolescent Israel residents 12 to 15 years of age. 12 to 15 years of age who had received the second vaccine dose during July 1 to 24, 2021. July 1 to 24, after the second dose. And here, a part of it, the efficacy part. After administration of the second vaccine dose, crude vaccine effectiveness against lab confirmed SARS-CoV-2 infection was 55.3%. So give me 1 second. I'm going to open the door so Luffy can go up. So my apologies. My family is not home today, so I have to tend to Luffy today as well. So back here. So crude vaccine effectiveness against lab-confirmed SARS-CoV-2 infection was 55.3%, and the range is 41.3% to 66.0% for 95% confidence interval. In the first week, this is important, first week, 87.1% in the second week. So you've given 2 shots, and then now you're measuring the efficacy, and in 1 week, after 1 week, or during the first week, 55.3%. 2 weeks during the second week, 87.1%. And in the first week, all right, sorry, I take it back. First of all, crude effectiveness against the infection was 55.3% in the first week. 87.1% in the second week, and 91.2% in the third week. 88.2% in the fourth week. And then they say vaccine effectiveness differed significantly between the first and subsequent weeks, but we found no statistically significant difference in vaccine effectiveness among the second, third, and fourth week. Now, what I owe to you is to look at the side effects of the vaccine from this study. So I will take that in the coming days, but I wanted to make sure that adolescent and their efficacy is in front of us right from the beginning. Now let's go to my illustrations and look at the discussion. So the question is, what is the latest about Pfizer-BioNTech vaccine? Objectives are to look at the characteristics of this vaccine, just to be on the same page, authorization status of this vaccine, then warning labels, efficacy. And we look at the side effects as well. So here are the characteristics of this vaccine. Let's see if I can actually find my marker to underline it. So starting from here, this is a messenger RNA-based vaccine. We all know that. It is against the spike protein. So what it does is it produces the spike protein inside the cell. It has a messenger RNA for it. The spike protein that is produced would then train the immune system to attack the spike protein. This vaccine is placed in a lipid nanoparticle, which becomes a vehicle to bring the vaccine inside the cells. It stays, the vaccine or messenger RNA would stay in the cytoplasm of the cell. Over there, it will use ribosomes, and that is how the vaccine would make spike proteins. It got the EUA, or emergency use authorization. This was the first vaccine to get EUA in the US, December 2020. This is also the first vaccine that has gotten the approval, full approval in the US, and that is August 23, 2021. The vaccine structure of administration of the schedule is that there is 2 doses are given 3 weeks apart or 21 days apart. And then they say they consider full vaccination at 2 weeks after the second dose. This vaccine has a storage requirement of minus 60 degree to minus 90 degrees centigrade during the transport. And then it can be kept for 2 weeks in the refrigeration when you're planning to open it, and that temperature can be minus 15 degree to minus 25 degrees centigrades. Now, warnings. June 25, 2021, and I want to look at that warning with you. Here, actually, this one. So this is coronavirus COVID-19 update, June 25, 2021. And if you see here, the warning in the fact sheet for the healthcare providers, this is FDA administering vaccine notes that report of adverse events suggest increased risk of myocarditis and pericarditis, particularly following the second dose and with the onset of the symptoms within a few days after the vaccination. And these bells that you're hearing, this is Kyrie sitting next to me and just grooming herself. So after the second dose, within the few days of the second dose, particularly in adolescents. So we'll see in young adults. Additionally, the fact sheets for the recipients and caregivers for these vaccines note that vaccine recipients should seek medical attention right away if they have chest pain, shortness of breath, or feelings of having fast beating, fluttering, or pounding heart after vaccination. Fast beating, we all are aware of. Pounding is when I think we are aware of that as well, when it really beats with a heavy beat. And then fluttering is running fast and kind of I can't explain how that feeling is. So that is where the FDA has given a warning with the Pfizer, and this is actually a warning with the Moderna as well. And if I go here for a second to Yale's paper, if you see here, the FDA placed a warning label on the Pfizer vaccine regarding a likely association with reported cases of heart inflammation in young adults. This inflammation may occur in the heart muscle, myocarditis, or in the lining of the heart, pericarditis, the outer lining, and is considered important but uncommon, arising in about 12.6 cases per million second doses administered. The inflammation in most cases gets better on its own without medical intervention. So again, does it become better or not? Do we need intervention or not? That all is a separate discussion. I wanted to make sure that we are aware and we are seeing that there is a warning label on this vaccine. So what are the things that should make us worry? If there is chest pain, shortness of breath, fast beating, fluttering, or pounding heart. Current status of this vaccine. The status is that for children 12 to 15, the vaccine is in EUA. For 16 and plus, it is approved. For 65 plus, a booster was just approved. And for healthcare professionals or other essential workers 18 and plus, a booster is also approved. So that means 3 doses have been approved. And I remember that we talked about it a few days ago. They approved it, the booster dose, and that approval, the kind of approval that came, the panel, the advisory panel had not given that broad an approval. For example, they had not given the approval for 18 plus healthcare workers or essential workers. They had said that 65 plus or at-risk patients, for example, immunocompromised or cancer patients and so on. But the director had gone beyond the advice and approved it for others as well. Now, what are the ongoing trials? This is being trialed for children from 5 years to 11 years of age. Side effects. So we know that there are a bunch of side effects. There are some side effects that are kind of more common and more prevalent as well. For example, chills, headache, pain, tiredness, fever, redness and swelling at the site of injection, soreness of the arm. These are common side effects that are observed. And this is my this is my depiction of somebody experiencing side effects. So apologies if it doesn't look that great. So when I look at this patient, I have some other issues. For example, the hands seem to have edema in them. Okay, so more serious side effects: cough or shortness of breath. Immediately call your doctor. Anaphylaxis can happen, and because of that, and we talked about anaphylaxis yesterday, or at least we talked about the type 1 allergic reactions, that anaphylaxis is one type. So we saw a mechanism yesterday. If anaphylaxis occurs, we need medical emergency services right away. This is why the vaccine recipients are kept in the where they receive the vaccine for 15-20 minutes for monitoring. Young adults, I'm repeating now this part, they can have cardiac inflammation, myocarditis, or pericarditis, mostly resolved on its own. 12.6 cases per million adults, second doses. And I'm going to go to vaccine. After this, I'm going to go back to the document from the UK government, and we'll just scroll through that a little more just to see it. Okay, so efficacy. The way to look at the efficacy, and there are so many studies, all of them offering efficacy changing and varying and for various age groups and comorbidities and so on, that to pull them all and just create a big table is difficult, but I tried to pull as much data as I could. So these two slides are the one which took some time. So we know that at the trial time, the efficacy observed was 95%, somewhere 95%, right? Then 6 months after the vaccine, so that is if I got the vaccine today and you start observing me from 7 days to 6 months, company reported the efficacy to be 91.3%, although there was a study that reported the efficacy to be 84%. And again, during the trials, the CDC severe case definition, and I remember talking about this in the Pfizer discussion earlier, 100% efficacy was observed. FDA severe case definition was 95.3% efficacy. This study that was done for 6 months and after, that found the efficacy against severe disease to be 97%, regardless of the CDC or FDA definition. New York State had released their data and they saw the efficacy to be 79.8%. So, one of the studies from New York. So, even on this page, you can see that efficacy is ranging, at least here, from 79.8% to 95% for the disease, and then 97% to 100% for severe disease. Then if you see this efficacy in May 2021, efficacy against alpha and beta, this is not about delta. The previous slide was about Wuhan, original wild type. This is alpha and beta here. Alpha and beta, 95% efficacy was observed, May 2021. Public Health England published two studies that are still to be peer reviewed. These were for Delta and for Pfizer, and they showed symptomatic disease efficacy or efficacy against symptomatic disease to be 86% and efficacy against hospitalization to be 96%. This is England. Israel, June and July data, Delta, symptomatic efficacy or efficacy against symptomatic disease, 39%. Hospitalization, 90%. So this is the efficacy that we know so far. Of course, Israel's response to this has been that they have given the third dose, and we have seen, I think a couple of days ago, we saw the Israel's dashboard as well, and we've seen the result there that with third dose they're doing well. There have been rumors or articles about the fourth dose. I haven't yet seen any official narrative around the fourth dose, so we'll see what happens. So this is the discussion for today. We will continue with this series. So we'll go from Pfizer to Moderna to Johnson & Johnson to AstraZeneca and so on. Sorry, so I want to show one more thing. So if you just wanted to understand the efficacy, here it is. I want to actually go over one more thing, and that is that document from the red card system, yellow card system from Britain. And DDS is today is the National Coffee Day as well. So let's sip some coffees and look at this one. So this is UK spontaneous reports received between 9/12/20 so and 15/9/21. So December 9, 2020 to September 15, 21. Again, I showed you the reference because my concern is that some folks would look at it and think that I'm just making up these numbers. So let me show you reference once more. Here is the reference on the UK's government site. So here, the document name is COVID-19 mRNA Pfizer-BioNTech vaccine analysis print PDF, and it is on the link that is assets.publishing.service.gov.uk, and then the rest of the link. This link is present in the description. So now with this, let's start. So I'm just going to, this is 98 pages, so I cannot go through all of them. I just wanted to have a cursory look with you on it. So let's just have, and I also want to give you this message that you would hear you'll see that in the comments as well. Number one, billions of doses are given, and the side effects ratio to billions of doses is not as high as infection to the side effects of the infection or the outcomes of the infection. So that is understandable and that is understood. Still, what I always, when I look at the side effects, I think that is how doctors are trained. When they look at the side effect, the question to look at side effect is the following. Number one, is there some kind of a cohort, some kind of a group, some kind of a profile of a patient who should not receive it, considering the side effects? Number two, are there some side effects that can be taken care of by doing something earlier before administering that drug, or by giving some caution to the patients, or by being ready afterwards? This is how a doctor would look at the side effects and decide what to do. So my point here is not to go over the list and say, okay, let's be scared. My point over here is to see, are there things that we can do better, differently, to maybe improve it? One thing that is not here is the profile of the patient. And because of that, we cannot actually say that, all right, young adults, they may have cardiac issues, so here are the things to do. So look at this, blood disorders. So various blood disorders, for example, anemic folate deficiency, vitamin B12 deficiencies, and so on. Lymph node pain, lymph node ulcers, lymphadenitis. So lymphadenopathy, look at the number, 8,935. Again, it would have been great, really, if at the top here, the government had added the number of doses. So at least one could say, out of X number of doses, here are the number of side effects. The second thing is, please realize that some of these side effects are going to be overlapping in one person. So it's not necessary that these are all one side effect per one person and the number of people is more. It could be more side effects in one person as well. Coagulopathies, abnormal clotting factor 4, antiphospholipid syndrome 5, coagulopathy 19, I believe. Disseminated intravascular coagulation, that is the clotting, DIC 2. Hypercoagulation 3. Thrombotic microangiopathy 2. So in general, we know that we've been talking about the coagulopathies with adenovirus-based vaccines. Here we're talking about a messenger RNA-based vaccine, and you're seeing that there are coagulopathies here as well. Hematological disorders, leukocytes. I have the link to this one. You can actually go through this. Lymph node pain, 1300. Lymphadenopathy, 8900. Hey, Kyrie. So marrow depression, neutropenias, platelet disorders, polycythemia, purpuras, red blood cell abnormalities, spleen disorders, thrombocytopenia, here 176. Cardiac disorders. Kyrie. So cardiac conduction disorders, that means that, so if I very quickly draw the conduction, heart's conduction. So what happens is, in our heart, we have an SA node. SA node is at the top of the heart in the right atrium, where superior vena cava kind of opens. This is superior vena cava. This is inferior vena cava. This is right atrium. This is the SA node. So from the SA node, there are 3 branches or specialized bundles that go around in both atria. Then at the inferior vena cava and the atrioventricular opening, over here is another node called AV node. And this is also called junction. From AV node, so all of these reach AV node, and then from AV node there is a bundle which moves through the tissue. There is a this is an insulating material between atria and ventricle, so the atrial electrical activity does not spread in the ventricles unnecessarily. So the information, the electrical information, goes through to ventricles through electrical wires only. So that is the bundle. And then there is this bundle divides into 2 branches that are his bundle of his or Purkinje branches, and then they go to the left and right ventricle. This is the structure. So what they're talking about here is, let's say, atrioventricular block. So atrioventricular block will be that this area is not functioning correctly. So atria and SA node is supposed to make the what is that impulse. That impulse needs to then go to ventricle. If there is an issue on the way that the impulse cannot go to the ventricle, then that will be an AV block. So we have AV block, complete AV block, first degree, second degree. So there are various kind of blocks. And then cardiac disorders, acute cardiac event in 3 cases, cardiac disorder in 42, cardiac dysfunction, cardiac deconditioning. So I want to see cardiac inflammation. So pericardial cyst, cardiac signs, cardiac infection and inflammation 3, carditis, cardiomyopathy 3, congestive cardiomyopathy 5, stress cardiomyopathy 2, cardiac failure. And again, we'll keep in mind that this is not necessarily vaccine caused it, but this is reported as someone suspecting that, hey, this may be the vaccine. And so interesting data over here, a lot of data. I cannot possibly go over all of this. At the end of it, once again, 324,654 reactions for the drug reported. Sorry, total reports are 114,752. My understanding is that this is the number of people who reported, and these are the various total side effects that were reported. And 534 are the deaths. So if you see here, for example, vascular disorder, total 13 deaths or fatalities. And so if you keep going, sorry for this mouse's sound. if you keep going, you can see various numbers. I just saw one over here for immunization 1 and so on. So it is an interesting document to look through if you have if you're curious about various disorder, or if you're curious that you may be predisposed to some of these disorders because of your comorbidities, then you can look at this. So with this, thank you very much. I'm going to come back in a few minutes and we'll do a chit chat. Please like, subscribe, and share if you like this work. And if you would like to support this, you can buy me a coffee. Today is a National Coffee Day anyways. So DD said. So you can buy me a coffee, or you can be a patron, or you can support it with PayPal. The links for that are in the description as well. Thank you very much, and I would see you in a few minutes.